Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in private practice located in Encino, California. And here's my lovely partner.
In beautiful Encino, California.
Beautiful Encino, California.
Hi, I'm Dr. Robert Jaffe. I am also a licensed marriage and family therapist. I'm a certified hypnotherapist as well. And we are here today to talk about addictions and codependency and relationships and trauma, all pretty important topics in the mental health field. A lot of people suffer from it. And we are here because we believe that we are born into the world as our loving, authentic, true selves. And we come in with certain qualities. We all come in with certain qualities, which are, we come in open. We come in, all of us, we come in curious. We all come in sexual. We all come in actually honest, believe it or not. And we all come in trusting that the world is going to welcome us. We also have other abilities, a couple of which are, we come in emotionally, the possibility to have emotional connection with others, to be compassionate with others, to be confident. And all of these abilities and more are ours to have and to express and to share. And along the way, we encounter some challenges, and those challenges get us off course. And what we're here to do today is to help us look at some of those challenges and get back on track so that we can be our loving, authentic, true selves.
Perfect. And to do that even more in depth, we would like for you to participate and to join us. Share your stories, share your challenges, ask your questions. This program is for you. And here's how you can get in touch with us. Our phone number here live is 951-922-3532. 951-922-3532. You can also visit us on our YouTube at heart-2-heart.online/YouTube. And please introduce this program to those that you believe that they can benefit from. We appreciate your contribution to this program, and thank you for spending your Friday morning with us. So, Dr. Robert Jaffe, codependency,
Yes.
addiction, relationships, a combination that is so chaotic.
It is. It
Right.
is. Yeah.
So, however, we know that it happens. We know that it exists. We know that families, friends, relationships in general, suffer from it, right? And then the other thing is that those who actually are codependent, sometimes they don't even know that.
Well,
Right.
people are most of us haven't studied psychology in
Right.
depth, and we don't walk around thinking in a psychological framework.
No, I mean, I'm talking about the symptoms of it.
The symptoms, yeah,
Right.
yeah. So, codependency, the reason we're talking about codependency is here today we're talking about it as the most common addiction.
Right.
that people have. And I'm using the word addiction because the way we're defining addictions is sort of as not just the usage of chemicals and alcohol. We're defining it also as certain behaviors. And we know certainly that people can be addicted to things that are other than chemical addictions. We know that people can be addicted to gambling, and we certainly have a Gamblers Anonymous, which is an offshoot of Alcoholics Anonymous, and that's for people who seem to get a high out of gambling. And we also know that, since you don't ingest chemicals, when you're gambling, or you can, of course, you can be drinking or whatever, but you don't need to be ingesting chemicals in order for gambling to be an addiction. It means it's a process addiction, meaning that your own brain creates the chemicals.
Right. So is that fair to say that generally, excluding from the type of addiction, whether it's a process addiction or it's alcohol or drugs, can we say that addiction is a state of mind?
Well, it's a state. Yeah, I mean, that's a very broad definition.
Yeah, it's a broad definition.
Yeah,
right?
it's a state of mind. Basically, what it is the goal of addiction is to feel better.
Right.
Right. So the goal of addiction is to feel better, and what's wrong with that? There's nothing wrong.
There's nothing wrong with that.
And everybody wants to feel good. And of course, the way we go about feeling good can be a positive thing for us, or it can be not so positive, right?
So it's a choice of behavior that makes addiction, a negative thing in our lives.
Yeah.
Right.
People also talk about addiction to work.
Right.
And yes, work can be an addiction too. Now, is that a negative thing? Well, it can be. Somebody who works hard isn't necessarily addicted, but if you're using work as a way of coping with emotions that you're uncomfortable with, and so you become so enamored of work and achievement, then it can be problematic, and it can be an addiction in terms of that's what we prefer to do above anything else. That's where we get most of our gratification from. And so we don't consider relationships, and we don't consider connecting with others, and we don't consider maybe even things that could make us joyful other than work as important. And so what that does is it limits us in terms of our scope of our being, and it also interferes with our ability to get pleasure in other ways. So there are addictions, and then there are levels of addictions. So somebody can be addicted, let's say, to alcohol, and doesn't drink every day or every night, but maybe they drink a lot on the weekends, and they get blasted on the weekend, and so that can still be an addiction, even though they're not drinking every day. So what we really are here to talk about is a mental health.
Right.
And mental health is about our authentic true selves. We just talked a little bit about some of the qualities of our authentic true self. And when we have mental health problems, what it means is the qualities that we were born with, the openness, the curiosity, the trusting. We talked about being emotionally connected with other people. Those become problematic. And so what we're here to do is we're here to talk about why they become problematic and what we can do about it once they do become problematic. And so addictions and codependency are first cousins. I would say that people who are addicts, for the most part, also struggle with codependency.
Right.
And people who are codependent often struggle with addictions. It's not exactly a quid pro quo that both occur together, but often they do.
So an example of that, in my opinion, and I have seen that, is a codependent person usually has some level of eating disorders or food addictions. Right?
Can be.
Yes.
Yeah, that definitely can be.
Yeah.
And people food actually can be an addiction.
Yes.
As we now know. And when people either overeat or undereat, it's a way of trying to make them feel better. The overeating has to do, well, actually both the overeating and the undereating, again, has to do with the idea that there's something missing.
Right.
And so I don't feel good, but when I'm eating, um, I get the taste and I get the sensation of fullness in my stomach, and
Yeah.
that makes me feel good.
It's instant gratification.
It's instant gratification, right? And when I'm under eating, the idea that I'm going to have a great body and that people are going to desire me because my body is so thin and looks wonderful, that can be the idea, so that they sort of starve themselves because they believe that that's going to get them attention, connection, and love.
And unfortunately, we have seen that sometimes that is true. I mean, I don't know about love, but the attention, they get sometimes,
Well,
Yeah.
yeah, people get attention in all sorts of ways, but I'm talking about when people undereat.
Right.
The idea is that they're going to be cared for. Usually, that's what the underlying feeling is. I'm going to be attractive, and love, of course, is the main ingredient that we're talking about throughout mental health, is feeling loved and feeling loving. And when we feel loved and when we feel loving, that's the thing that we are all searching for. And since we don't know, number one, sometimes that it's even possible to feel loved or loving, because we haven't gotten a lot of that in our life, and that hasn't been modeled for us as to how to do that, then we substitute other things, and anything that we substitute for feeling loved or loving can be problematic because it isn't going to fill that place inside of us.
Right.
Yeah. And I think it was Sigmund Freud, who most of you listeners are familiar with the name at least, who was one of the great fathers of modern psychology. He said that the goal of psychotherapy is the transmutation from fear into love, and that really is the bottom line. So when people talk about going into counseling or therapy, they often don't know that that's really the goal, and they have other ideas about what counseling and psychotherapy is. But any psychotherapist or any counselor who is good at what they're doing has that as the main goal, is to feel loved and loving as much of the time as they can.
So that's a wonderful and broad subject, which we are going to be opening it up and talk about it more right after our commercial break.
Absolutely.
See you then.
See you soon.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. And this is another episode about codependency, relationship, and addictions. And we would like to invite you to please call us 951-922-3532. You can also visit us at heart-2-heart.online/YouTube. So, Dr. Robert, we were talking about codependency as a form of addictions, and we kind of went in a broader perspective and talked about some other aspects of it.
Yeah.
So,
absolutely. Well, the last thing that I commented on was what Sigmund Freud had said, which was the goal of all effective psychotherapy is the transmutation from fear into love.
Exactly. I mean, that's such a nice way of putting it, but what goes on between the fear and the love, and until a person gets from the fear to the love, it's a journey by itself.
It's a journey, yeah.
Right.
And the reason that it's a journey for most people is because it isn't necessarily that our parents didn't love us. We all like to believe that our parents loved us. But the issue is not really whether our parents loved us. The issue is whether we felt the love. And we felt, because what love does is it makes us feel connected, not alone, and safe physically and emotionally. Safe to do what? Safe to be our loving, authentic, true selves.
Right. Welcoming me to the life.
Right.
I know.
Right. And so what happens in terms of addictions and codependency is because our parents were raised by their parents, who were raised by their parents, who were raised by their parents, on and on and on. A lot of things happened in the parenting and in the relationship, where at the very beginning the child came in and the parents didn't necessarily have a great idea of who they were. They were still struggling with their own identity issues and their own lovability and their own feelings of competency in the world. And certainly parents who had their own addictions, such as drug and alcohol addictions, such as work, such as gambling, and other kinds of addictions.
Their attitudes, their beliefs,
Right.
Their way of life, their own trauma, their own PTSDs, right? Everything that went on their life,
Yeah.
Comes to the play when there is a child, develops.
Right. Now, why are we talking about parenting right now? I'm talking about children. Well, I'm going to say that a lot of codependency and addictions stems from difficulties that the child experienced at a very young age. And what I'm thinking right now is my two granddaughters, who, as we speak, are just turning 2 years old, and how much they have absorbed in the first 2 years of their life, and the fact that now at 2 they're beginning to talk. And once they begin to talk, it's incredible what comes out of their mouths, because they were totally, they didn't know how to talk. They didn't know how to put words together. They didn't know how to turn thoughts into words. But that was all going on for the first 2 years, and now it's all coming out, and they're able to say things that we go, wow, look at them. They're still babies, they're still 2 years old, and yet they're able to put out complete sentences, complete ideas, their own thoughts about things.
And then what's interesting to me, they both have two totally different characters.
Yeah, personalities.
Personalities. I mean, they are born to the same family. They're twins, so you would think that they follow each other, but we see that, and that's, to me, is very incredible. And that one is very, quiet into herself. She has totally a different attitude than the other sister, who's very all herself and out there, and
one is more inward, one is more outward.
Yes,
and they're very demonstrative of those things.
Right.
They're both very bright. They're both very sweet. They're both very very lovable.
So there's the perception. This is a good demonstration of how we perceive the world around us, and we develop our personality based on that.
Exactly.
Right.
Exactly. So we're not here talking about one personality being better than another personality. What we are talking about is that at the very beginning, as we're born into the world, and the first 5 to 10 years of life, we encounter things that we have to navigate. And our parents are able to see us for exactly who we are and encourage us to be who we are, to the exact extent that they were encouraged to be who they were. And if they were encouraged to be who they were, and they encourage us to be who we are, and they don't put a lot of trips on us, a lot of do's and don'ts, a lot of controlling behavior, a lot of anger, a lot of negativity. If they don't do that, then we get to be our authentic true selves. And if they haven't been allowed to be their authentic true selves, then they put those trips on us. And they don't do it on purpose necessarily. They usually do it subconsciously. We pick up on how we're supposed to be because remember, when we're little, we can't take care of ourselves, and we know that we can't take care of ourselves. So we have to please our parents, and I'm talking very little, 1, 2, 3, 4, 5. We know that we're dependent on them. And so if our parents give us rules and behaviors and are controlling, we have to comply if we want to survive. And the survival instinct is ingrained in us as part of who we are as individuals, right? Every person that walks around has a survival instinct, and that's the most powerful part of us. So we know when we're little that we have to survive, and so we begin to shape ourselves in the way that we know we're going to survive in that environment. And that becomes not necessarily our authentic true self, that becomes what we call our adapted self. We adapt to the environment.
Right.
And that, of course, that adapted self, if that adapted self doesn't ever grow out of it, then we can call that adapted self the false self, because it isn't our authentic true self. It's the self that we had to adapt in order to survive. And that self can become a codependent self. And so here are some of the qualities that codependent people have. Some of them are rescuers and fixers, mm-hmm. right? Some of them are people pleasers. Some of them are overachievers. The overachiever is the person who adapts by saying, "Look, I'm great at all of this. Look how wonderful I am," and they fill that inside emptiness, because all of the codependency is about not feeling that connection, that loving connection inside. So they fill that emptiness with achievements and with showing off how great they are. Then there are the flip side of it, those who feel not good enough and who act inadequate, or they fail a lot. It doesn't mean that they're stupid. It doesn't mean that they can't succeed. It means that that's the way they've learned to cope with the situation. Sometimes they don't want to show up their parents. Sometimes they feel like the parents don't think highly of them, so they're conforming to the parents' less than positive expectation of them, and so they fail. Then there are perfectionists. Now, perfectionists are not people necessarily who are striving for excellence, but they're people who have to have everything exactly the way they think is perfect, because if they don't, they leave themselves open for criticism and negativity. So they believe that they have to be perfect in everything. Then there are people who are martyrs, right? The martyr is the person who sacrifices themselves for somebody else and says, "Look at how wonderful I am because I have sacrificed myself."
And then next to that, of course, is victim.
And the victims, yeah, people who are victims in the world. And then people who are actual addicts.
Right.
People who are addicts. These are all people that I'll expand a little bit right now because we're just touching on this.
What I see, as you're talking about characteristics of how a codependent may function, right? I see that fundamentally, regardless of the type of or the choice of behavior, mm-hmm. It's all fundamentally is based on fear. Mm-hmm. So the fear is the shared factor,
right,
underneath being a codependent person.
Exactly. Right? Yes, and that's a wonderful observation, because right. And of course, when people walk into the office of a therapist, most of the time they don't come in and they go, "I have a problem with fear."
Right.
They're not aware that underlying it is fear, and even if they were aware that it was fear, they might say, "Well, my fear is real. My fear is justified." and that's because it has been. In other words, we're not making this up as we go along in order to become codependent, right? We adapt in order to survive, in order to show other people that we are worthy of being around them.
I mean, I can also see this that, and based on my work with my own clients, uh, and then going back to your comment about surviving instinct, right? Uh, so the need to survive, right? That
Mm-hmm.
means if I don't have my mom and dad next to me, I may die, right?
Mm-hmm.
That's so fearful. That's such a
Mm-hmm.
powerful feeling of fear that I need to, keep my relationship with these two individuals.
Right.
Otherwise, I won't survive. So I guess fear is a feeling that starts to show up early on in our lives.
Correct. Correct.
Right, before
yes.
we experience happiness, before we experience sadness, before even we experience anger. I think that's probably the fear is fundamentally is experienced during even infancy.
Well, look, we've talked and we're going to continue to talk
Right.
about the two aspects of the human being.
Right.
The human part is the part that we're going to call ego.
Right.
The being part is the part that we're going to call spirit,
right,
or heart, right, or soul. And the human part is endowed with the desire to survive.
Right.
Right. We all come from one sperm. There were many sperm that attempted to get up the fallopian tube and impregnate the egg.
The marathon of the sperms.
the marathon of the sperm. There were more than 1 million. There were more than 10 million. There were maybe 100 million
right. And
of the sperm, and one of them made it.
Men are so proud of that.
Well, it's our tiny contribution,
right? Right.
But what I'm saying that is because we're the one sperm in 100 million that made it, and we made it because we're strong and because we wanted to survive. We were the strongest in terms of survival, right? We're the ones who survived. All the other sperm, they did their best, but they couldn't quite make it. And so we, being here, come into the world with this powerful survival instinct. I'm here. I'm her world, and I ain't going anywhere.
I won the lottery of life.
Exactly.
Yes.
Exactly. So the instinct for survival is that, and fear is the thing that makes us survive, right? When the saber-toothed tiger is chasing us, we got that adrenaline rush, and we're going to pick up that rock, and we're going to throw the rock at it and distract it, and then we're going to climb the tree, and we're going to get out of its way,
Right.
So that's the human part of us, and the human part of us has access to the adrenaline and has access to the fear hormones,
right,
which empower us to survive, and that's a good thing. We need that.
Right. Yeah, fear is not always a bad thing,
No.
but it actually helps us in many circumstances. However, the fear that we are talking about is not fear of how to cross a street.
Right.
Right. We're talking about how to survive as a human being.
Yes.
Right.
Yes. And so, of course, when we're tiny, we know we're dependent, and we get scared very easily if we're 3 months, 6 months old, and all of a sudden we don't see mommy around. It can scare us.
Right.
Just the fact that mommy's not there at that second. So where are we going with this? We're going to a place where fear is necessary, and we all have it. But if we stay in fear, it doesn't complete us, because that's the human part of us. The being part of us is the part that isn't afraid. The being part of us is the part that wants love and connection, wants to feel positive, wants to feel happy, joyous, and free. And that part of us, when it becomes underdeveloped because the fear is overdeveloped, That's the part that we now have to recover. And so we call addiction recovery, and it's really recovery of our authentic true selves that has the being part of us attached to it. Yeah.
And more of this amazing discussion right after our commercial break. See you in a few minutes. Welcome back to Heart program at KMET 1490 ABC News Radio. Our discussion today is about codependency, addictions, and relationships, and we have covered some fundamental, characteristics of what codependency is and how it plays out and where it may originate. And this subject is so broad that we're going to spend weeks and weeks on it, because it's injustice if we just let go of some of it and not mention that, because we want to understand exactly what codependency looks like and how do we play out, that these characteristics in our relationships. So, Dr. Robert, we talk about some of the, titles of what it means. What a codependent does, right? Like people pleaser, or
Right.
So, can we just describe a little bit more in depth?
Sure.
Exactly.
Sure.
What do we mean by?
Right. So what I'm going to do right now is I'm going to just give you the titles to the different aspects, and then I'm going to go more in depth in one of them, because obviously there's a lot and we can't do it all.
We can't do it.
But,
so what is the most common one that we see in psychotherapy?
Right. Okay. So I'll give you the titles, and when I give you these titles, you may notice either yourself or someone close to you has these traits. The fact that they have these traits, as you were so wisely commenting on during the break, is not an evidence that you're codependent, but it's not just having the trait, it's when that trait becomes problematic in your life or in your relationships.
Right.
So, but I'll just give you the titles right now, and I mentioned some of them earlier: rescuers and fixers, people pleasers, overachievers, inadequate ones or failures, perfectionists, victims, martyrs, and of course, people who are addicted themselves, people who are compulsive, people who are grandiose, selfish or narcissistic, bullies, abusers, lost children, and then the last one is comedians, or we call them mascots or little princesses. So these are the different traits that people may adapt when they have created a false self. And all of these are roles that people play in order to survive in the family that they were raised in. So we'll pick one of these, and the one that I'm going to pick right now is the selfish or the narcissistic ones. Okay,
right. That's a good one.
Yeah. They're actually all good, but
yeah. Well, we see that in our clients, especially when it comes to couples therapy.
Right. So it's actually the opposite of what you would think about when you think about codependency. Usually when you think about codependency, you think about people who are people pleasers and who do for others and don't take care of themselves enough. Narcissists, because they didn't get what, and this is true for all people who have been injured as children. Narcissists, because they didn't get what they needed, decided that that from now on everything is going to be about me. Everything is about what I want, and so what they do is they disconnect from others, and they have difficulty empathizing with other people because everything relates to them. And narcissists can be also overachievers, because they can say, okay, since it's all about me and everything is about accumulation of money and property and all of that. I'm going to get as much as I can. And so you find narcissists often at the top in business. You find people who are very business, politics, government. You find people who are very, very me oriented, and unfortunately, it's to the detriment of other people.
Yeah, nobody's good enough for me. Nobody's doing good enough work. Nobody's doing good enough, whatever task they are assigned to.
Right.
There's always a problem with what they do. And then the problem is that, when somebody who's narcissistic and doesn't believe that others have met the expectations of this individual, they go back and attack the person as being incompetent, as being stupid, as being not able to handle a simple task, so they kind of downsize their, their efforts and productivity and the time, everything that the person went through to accomplish something.
Right.
So for a narcissistic person, all that means nothing, because still is not at that imaginary level of excellence that he wants it to be.
Mm-hmm.
So there is a difference between perfectionism and narcissism, but it's a very thin line between the two, I think.
Yeah. So with narcissism, we have to look at the concept of mirroring.
Right.
What is mirroring? Mirroring means that when you're a child and you're having a certain emotion, that the parent empathizing with you can understand what it feels like to be sad, to be hurt, to be scared, to be disappointed. So, for example, I was talking about my two-year-old grandchildren, and so they're very, at 2 years old, they're very competitive with each other in terms of one starts playing with a toy, and even though there's a million toys there, the other one wants the one that the first one is playing with, right? So the second one will go over and grab the toy out of the first one's hands, and then the first one will either try to get the toy back or will cry, right? And then so my daughter, who is an excellent parent, she says to the one who's crying, "Oh, honey, that you got your feelings hurt, and you feel really disappointed that the other one took the toy away from you, and that really wasn't fair, and I understand." Now, what that means is she's mirroring what the one who's crying is feeling.
Right.
She's telling her and showing her exactly what's going on inside of her, so that the one who got hurt and got the toy taken away will understand what's going on inside of her. And so once you understand what's going on inside of you, then you're in a much better position to assert for yourself and then to become comforting for yourself. So my daughter will tell her what she's feeling, and then she'll come over to the one who just took the toy, and then she'll say, now let's say the one who took the toy my granddaughter's names are Sophie and Vivian. So let's say if Vivian took the toy from Sophie, then my daughter will walk up to Vivian and she'll say, "Honey, Sophie was playing with that, and there's plenty of other toys, and you can certainly have your turn with the toy, but right now it's Sophie's turn." See, so now she's explaining to Vivian exactly why it was unfair that Vivian took it, and she's helping Vivian to recognize that, oh yeah, it was unfair, and I can play with other toys.
Right. And this is such a, amazing way of handling conflict between two child at that age, because this is where we are helping these children to understand their feelings, to understand their behavior, to understand how they can make choice, and they understand how to interact.
Right.
And this is the core part. And then when we are able at that age to understand our feelings and to express them, then we see that fear goes away, because
Mm-hmm.
there is a way that we can describe ourselves, there is a way that we can understand ourselves.
Right.
Right. And that's okay to feel that way. That's okay to, to experience life, and there are solutions to it. So this dialogue that you just explained, it's a perfect example of how parents need to kind of intervene and to be there for children, so children can understand and make sense of their behavior, choices, and feelings. However, this doesn't happen many times.
It doesn't happen very often.
Right.
And actually, it's just because our parents didn't know how to do that.
Right.
And why didn't they know? Because their parents didn't know. So this is really an evolutionary thing.
Right.
We're learning things as we go along. And this isn't about bashing our parents or bashing ourselves if we're parents, but it's about saying, I didn't know any better, and now I can learn and do it differently, right? So going back to narcissism, right? Our feelings weren't mirrored for us. We didn't understand what we were feeling. Usually parents attend to behaviors without including feelings. So for example, if Vivian took Sophie's toy away, the average parent would say, no, that's not for you, this is for her, and just take the toy away from Vivian and give it back to Sophie. Which would leave Sophie feeling vindicated, but Vivian feeling confused. Like, I don't know what I did. All I know was that I did something wrong because the toy was taken away, because my feelings about it weren't attended to. My feelings weren't explained to me.
And then the experience of anger in mom's tone of voice is also another factor. It actually creates fear in both of the children.
Correct. Yeah. So what happens then is, because of the lack of mirroring, that the person becomes, it's all about me, and then they look for mirroring in other people, which means that everybody has to agree with them. The problem is that they didn't get the mirroring at an early age when they needed it the most, so nobody can agree with them perfectly enough. So the person who is narcissistic believes that they are better than others, and they can see the faults in everyone else, and that they know better than everyone else. And so that's where narcissism starts to develop. And so narcissism then creates more loneliness inside the narcissist, who then usually goes for achievements in order to fill up that sense of loss or loneliness in themselves. All codependent behaviors, as we talked about earlier, is trying to fill an empty place inside of us, and that empty place is a feeling of being seen, noticed, appreciated, understood, all of which are qualities of love that we didn't get when we needed it the most.
Right. So when we call somebody selfish, the behavior suggests that's selfish, right? However, there is so much pain and loneliness and fear underneath that.
Right.
Which is not recognized majority of time unless person, goes for psychotherapy to understand what's going on. And then selfishness is not even recognized by the individual himself or herself.
Correct. Correct. Yeah. And along with narcissism usually goes grandiosity. Sometimes grandiosity is a state where, like I was talking about narcissism, it's a state of I can do anything. I'm invincible, and I can do anything, and I can do anything better than anyone else can do it. And so narcissists often fluctuate between the feeling of I'm better than to feelings of I'm a piece of crap. And they go back and forth between those two feelings because what they're really missing is someone actually validating them for their qualities, not for their behaviors. we overvalue in our society behaviors and we undervalue qualities, so that we see somebody doing something that we can't do and we put them on a pedestal, not recognizing that that person is just like us. They're human and they have all the same feelings, all the same frailties, but they happen to have excelled in a particular area or maybe several areas.
That's an interesting point that you just mentioned. I hope we have some time to reflect on that. When people go for jobs, for example, they are given a set of, checklist of what to do, right?
Mm-hmm.
But what is missing is that each person has their own qualities that they can contribute to the job.
Correct.
Right. But when the focus is only on the job, then the qualities are dismissed.
Mm-hmm.
Right.
Mm-hmm.
And then that's a hard part into making a job working perfectly for the employer and employee. So I'd like to continue this discussion next week if you're okay with that. And don't forget to please join us Thursday at 3 o'clock for another episode about sex, sexuality, and relationship. And next Friday, same time, 9 o'clock, for another episode of Codependency and Addictions and Relationship. And until next week, don't forget, all you need is love.
Love, love, love. Bye-bye.